I'm Susan Khalil. I'm an assistant professor at the Icahn School of Medicine at Mount Sinai Hospital in New York City. I'm from the Division of Minimally Invasive Gynecologic Surgery and the program director for the Fellowship in Minimally Invasive Gynecologic Surgery here at Mount Sinai Hospital. So I think, it's the technical challenge sometimes that presents with uterine artery embolization, and trying to improve access to minimally invasive hysterectomy was really the driving force behind this concept and behind collaborating also with my co-authors on this abstract that was presented at ACOG. Patient safety is going to come first, and sometimes large uterine fibroid size can also just limit visibility, can increase chances of having additional things that can add to morbidity. So performing it in the safest way that lets the patient live a healthy life is critical. And it's also reflective at times of what's available in current practice and what's been around for the last 13 years, which is the time frame that covers this article as well. That one's a little bit limited, but the weight that is associated with it is definitely a predictive factor. I think imaging and clinical exam can give you approximations of what your anticipated uterine weight is, but largely sometimes it's a retrospective diagnosis. I think this can help with clinical decision making and clinical surgical decision making, with ways to optimize patient safety, ways to reduce blood loss, and ways to enhance feasibility of accomplishing hysterectomy with lower morbidity by adding this as an additive tool. That's something that's more available, readily available than it was previously. Yeah, so I think one takeaway is that performing the staged uterine artery embolization can make this more feasible. So it's an approach to consider. I think a second takeaway would be that there are different mechanisms for reducing blood loss with hysterectomy. And the third takeaway would just be that you can try to reduce patient stay and other outcomes by using this approach as well. I'd like to just emphasize also just the need for greater research on these topics. I think there's a lot of surgical techniques and advances in surgical innovation for women's healthcare, and they really require great infrastructure for research to accelerate this phase where we're actually able to do more things with minimally invasive surgery now that we've established the feasibility and safety of it. And that's where I would love to see just more research on different surgical techniques, surgical innovation, so that we can really accelerate women's surgical care delivery as well.